Hi, everybody, and welcome to this STL Partners webinar, Telco Health Strategies, Lessons from TELUS and Babylon's Partnership. In terms of what we'll be covering today, we'll be looking to do a brief kind of round of introductions in terms of who's speaking on the panel and who's going to be presenting. Then my colleague Amy will cover why healthcare is a good vertical for telcos to be looking at, and how might you as an operator look or choose to play within this space. Then we'll hand over to TELUS and Babylon, who will run through kind of the success that they've seen with their digital health partnership and some kind of key learnings for anyone who's looking to emulate. And then we want to leave a good amount of time for a Q&A session at the end to answer any of your questions. So in terms of who's on this webinar today, as I mentioned, we've got my colleague Amy Cameron, who's a senior analyst at STL Partners and leads our research into digital health. We also have David Thomas from TELUS, who is the managing principal in the global health strategy. And then we have Mairi Johnson from Babylon Health, who's the head of corporate development. And I'm Darius. I'm a senior consultant at STL, and I'll be moderating this session for you. So before I hand over, a little bit of housekeeping. So you're in listen-only mode. We won't be able to hear you, but if you do need us, there should be a comment tab on your GoToWebinar platform where you can message us if you have any questions about the technology, or if you have any questions that you'd like to ask the panel. And when we come to the Q&A session at the end, we can hopefully have time to field your question. In terms of kind of after the session, this will be recorded, so we'll be able to share with you a recording which you can watch on demand. And we'll also be able to share the slides from the session, so you can have access to the PowerPoint presentation itself. For those of you who are on Twitter, you can tweet us at STL Partners if you have any questions about the session or feedback or comments. We'd love to hear them. So without further ado, I'll hand over to my colleague Amy, who can run you through the first part of the presentation.
Hi, everybody. Thanks for joining. So before we get into the good stuff with TELUS and Babylon, I'm going to go over some of our research and thinking a little bit about why healthcare and how the opportunity is developing during the current circumstances. So just to show you a little bit of research that we did recently, which was looking at what telcos' investment priorities are currently in the wake of COVID-19. And we asked telcos, do you think that you are going to increase or decrease investment across different areas? And in this particular chart, I'm showing you the questions we asked for a few different industries. And what you can see is that for respondents across all regions, digital health is an area that they're very interested in and where they think that telcos are likely to make increased investments in over the coming months. And it'll be obviously no surprise that this is in large part or partially due to how COVID-19 has changed our needs, and people really need digital health solutions. And there's a lot of different data going around about increased use of virtual care, increased use of remote consultations, the industry getting a kind of boost that could only occur during a crisis scenario. So no wonder people are looking towards this industry as a potential area of opportunity. And I've just got here, an example from Teladoc, which is one of the leading virtual care providers in the US, and the massive growth that we saw in terms of use of their services in the first quarter of this year, which will no doubt rise even further for the second quarter results. And I think that what's happening is this is reigniting telcos' interest in a vertical where we think it's a very attractive vertical for them and they have a strong right to play. So just thinking about it from the attractiveness of the vertical, healthcare is a good one for telcos to target because we know that it's going to be there. These are needs that our societies are going to have over the long term. People are getting older, and they're going to need increasing healthcare to support increasing incidence of chronic disease management. So it's a really sustainable market. And the second point is that compared to many other sectors, there's still a low level of digitization. And so there's a lot of growth still to occur. There's a lot of stuff that needs to happen for the healthcare sector to adopt more digital solutions. Then thinking about quickly the the opportunities for telcos and why they have a strong right to play. Of course, digital health is dependent on telco infrastructure. And to make it work well, we need some reliable connectivity, particularly when we're thinking about using digital health to deliver better quality care in rural or remote settings. But on top of that, because a lot of it is going over their infrastructure, they may be able to offer additional security or other services through that network, which is important for healthcare. Next, healthcare is a nationally bound market, and telcos operate nationally. They know their local markets well. They have strong relationships with regulators, with the public sector, with enterprises, and they understand the local market dynamics, and health is an extremely local market and therefore well suited to telcos and their local presence. And finally, telcos bring a lot of weight in terms of their brand awareness and longevity. So if we think, for instance, about digital health companies that are trying to help people live independently longer with wearables or remote monitoring solutions or what have you, if you're a digital health company that the consumer doesn't know, they don't know if you're going to be around next year, they don't know how you're regulated, if they can work together with a telco that has strong brand awareness and is well known in the market, that can add weight and make it a more credible service for consumers. So that's just an example of how brand awareness and longevity can help telcos play in this market. But I think telcos we need to not get carried away with the spurt that we've seen over the last few weeks in use of virtual care, because the reality is that this is a spurt, but that healthcare is still a slow-moving and difficult industry to work in, and telcos need to develop solutions and go into that market sort of aware of what those long-term challenges are. So thinking a little bit in terms of how digital health is likely to change after the peaks that we've seen. If we look at this chart here on the left, in the phase one in the blue line, you have a big spurt in demand for virtual care, for virtual consultations, as in-person care is no longer possible. But once social distancing restrictions ease, that demand is going to taper off, and the solutions are going to need to be able to prove that they really do deliver on cost savings, they really do improve healthcare outcomes. And for them to sustain over the long term, they're going to need to bring these proof points to market. I'd like also to draw your attention to the phase 3 line, where we're already starting to see this, is that healthcare systems that have deferred a lot of appointments during the current environment are going to have to deal with a lot of patients that have deferred care. And that's a big opportunity for digital health solutions to potentially help deal with seeing these patients and treating these patients more efficiently. And just to say, this is already happening. I saw the headline in the UK yesterday that there might be 10 million deferred patients on the NHS. So that this is really going to be a challenge for healthcare organizations going forward over the coming months. In terms of the long-term challenges that telcos need to face or prepare themselves for, one is more stringent regulations and being prepared to adapt to them. And I think that Mairi and David will be able to go into that bit more detail for you guys. The second is understanding the local healthcare delivery challenges. So every market will have different priorities, different regulations, different needs in terms of digital health, and telcos need to take that into consideration when they're planning their strategies. Third is a need for commitment that's more than just a business. If you're just going into healthcare, if you give the impression that you're going into healthcare because it's going to be a big business for you, then that doesn't make you necessarily the most trustworthy partner, particularly when the end user isn't a consumer, it isn't a customer, it is a patient. And that needs to be reflected in your approach to the market. Next is patience for slow funding decisions and change in ingrained work behaviors. And we've seen some really rapid change in regulations and working behaviors over the last few months, but there is a very strong likelihood that people go back to normal before, and changing those behaviors over the long term will still require a lot of work. And then finally, finding the right business model and partners. And that's what that's what today is all about. So hopefully we'll hear more about that from David and Mairi. The question that we get all the time from telcos is, what should we focus on? And the reality is that there's a huge range of applications. So there are things that are, directly going to the end user patient, whether that's helping them to manage a long-term condition, whether that's helping them to diagnose a condition more effectively and figure out what part of the healthcare system they should be going to, whether that's accessing some kind of virtual care over the phone or through video, or some kind of remote monitoring with a device that helps them, manage a disease over the long term. After that, there's all of those top level applications plug into the health IT systems, whether that's for a hospital or for a GP or for a care home or for a pharmacy. And then finally, in the yellow box, we have all kinds of applications that are focused on bringing together all the different component parts of the healthcare system, sharing data across them, enabling services like online prescriptions to go across them, and things like population level analysis. And the reality is that you can't just say there is one area where you should be playing, because choosing where you want to play, as I said, depends on the priorities of your local healthcare market, as well as the ambitions of your company. So, for instance, playing in healthcare IT in the light blue box, that's really where telcos that have taken a deep dive into healthcare are playing. And is it really worth it if you don't have the appetite for that, if you don't have the long-term appetite to deliver that kind of solution, then you may not want to play there. So if we do try and identify where you would play in that, let's think about where do investors see the greatest value now? So if you look here in 2019, healthcare startup investments, there was a lot of stuff on patient empowerment. And those are, really related to the dark blue boxes on the previous slide, things allowing patients to see their personal health records and take better control of their own health. And clinical workflow, which is helping things run better within institutions. And you can see that things like administrative workflow is relatively less interesting. And that's partially because there are already a lot of solutions on the market for managing patient records and managing the back office systems. So that's potentially less exciting. But what really needs to happen is to look into, at the local level, what's happening. So as an exercise in this, let's take an example of the UK. So if we look at healthcare spending over the UK in the last few years, you can see that in the last couple of years, there's been a lot of growth in out-of-pocket expenditure. And then in 2018, quite a lot of growth in government-financed expenditure. But the out-of-pocket expenditure makes you think that sort of B2C angle might be attractive. So if you were a telco in the UK, you might think, well, there's a lot of growth going on here. I should think about solutions that people are willing to pay for out of pocket, as well as potentially valuable to a government payer. Then you could look in a little bit more detail and see, if we look at the top bar on this right-hand chart, where is this out-of-pocket expenditure going? And it's going on medical goods, and it's going on long-term care primarily. So then you might think more specifically, well, we should target some B2C solutions that help people live independently for longer. That might be a good opportunity for us. So that exercise, this is something that we're going to be researching in more depth. So, look out for it from STL, but it is a market by market analysis. The next question is, what's the business model? How do we bring these solutions to market? So for telcos, there's obviously supporting at a connectivity level. And the two big buckets there is working with medical device companies to help them deliver a better experience, to have better quality connectivity, more seamless connectivity, more reliable backup connectivity, to make their products work better. And the other side is enabling healthcare organizations to implement next generation connectivity. And that might be hospitals or care homes or local councils or GPs, all sorts. The next layer up is application enablement. And this is really thinking about the telco assets that you have and how they can support the digital health companies in bringing their solutions to market. So the main one that is the biggest area in healthcare is the secure messaging, and that's what you need to transfer data across all the different systems, from the hospital to the family doctor to the pharmacy to the specialist, and transferring that data securely across the healthcare market. So telcos can support that, but they can also deliver some medical grade privacy and security over their network. They can help with consent management, billing integrations. There are many different ways that they can support digital health companies. And I think that Mairi and David can go into that a bit more detail as well. Finally, for particular applications, there is a wealth of different ways they can do it. And so starting from the far left, telcos might take a B2B approach with health IT solutions. And that's, as I mentioned before, if they're really, going through M&A and making a big play into healthcare. There might be a B2B channel for digital health companies. For instance, if they have a strong relationship with a hospital that wants to deploy a home health monitoring solution, or with a government body that wants to deploy some kind of digital health solution. So the telco has that relationship, but they don't necessarily have the technical skills. So they might partner with a digital health provider in order to deliver that. Next, you have sort of moving more towards the end user being the patient or the consumer, where the telco can help bring that to market and deliver it directly to the end user, but that might still be funded by a third party, whether it's the government or an insurance company. And then the last two are really about consumer paid out-of-pocket solutions that telcos could help digital health companies bring to market or attempt to do on their own, although that hasn't necessarily gone very well for them in the past. So going back to our example of how telcos can help deliver long-term care solutions and let people live independently for longer, we did some research on this and sort of thinking about the different business models for telcos. And I won't go into a lot of detail, but what you can see on this chart is it's an example of telcos that have partnered with digital health companies and what they provide to them. So in the core competence area, AT&T is providing backup connectivity for a digital health solution. But other things that telcos could provide is things like location finding. And in that example, it's for wearable tracking people who are liable to wander away from their homes and in the middle of the night or what have you, so that can send alerts. And all the way up, as you go further up the chain, it becomes a little bit more difficult for telcos to play there if they don't have a credible brand in the healthcare space, which is not what most telcos have. So I'm going to stop there from my whirlwind tour and hand over now to our stars of the show to tell us a little bit more about how they work together and how they have it, and how they address the healthcare market.
Thank you, Amy, and thank you everybody for attending today. I'm going to go through sort of 4 parts to TELUS. First, I'll give you a little bit of background on who TELUS is, and second, I'll spend a little bit of time outlining what TELUS does in healthcare, and the full range of what Amy referenced in terms of how we go to market, because we cover the full range. Then I'm going to spend a little bit of time talking about the strategy and approach, which then introduces a little bit about the why we partnered with Babylon and how that's playing out. And then I literally will spend time on what's great about our partnership with Babylon. And then Mairi gets the chip in after that. So if I have control of the slides, I should be able, whoops, jumped ahead. So the first slide is about TELUS. We're a telecommunications company based in Canada, as many of you know. We have a full range of services: internet, voice, entertainment, health, video, IPTV, and home security. We're one of 3 national carriers in Canada that deliver coast-to-coast services. Canada, as many of you know, is a vast landmass, low density, most of our 36 million population scarily clustered along the 44th parallel next to the US border. In addition to our national scope, there are 3 business lines that TELUS offers globally. Business process and IT solutions, since we offer a full range of IT support desk functions, outsourced business process reengineering to global companies under the banner of TELUS International. We currently operate a network across from Philippines, India, China, Central America, UK, and Central Europe. We also offer a variety of business solutions and IoT services to multinationals and Fortune 500 companies in a B2B space. And in the last 2 years, we've launched a global healthcare technology service, providing digital strategy, platform technology, and digital solutions. So that's TELUS. I'll move to our healthcare business. Our healthcare business is, I'm not controlling this very well, Amy. You did a better job. And let me go back up here.
I can take control if you like.
My mouse is moving very quickly through the slides. There we go.
You're good.
We are good. So in healthcare, and the reason why I'd be invited to a call such as this, TELUS made a decision back in 2008, recognizing early on that this sector had significant digital transformation potential. And we chose to invest very heavily in this sector, while other national carriers in Canada made more significant investments at that time in the entertainment market. So we've made to date $3 billion investment in the health space. Today, we're the largest digital health player in the Canadian market, and other telcos in Canada have actually moved out of the digital health sector, other than offering more traditional telco services to healthcare providers. In my view, there are a couple of key factors that have enabled this. One is right from the board of TELUS down to the business unit, there's been a long-term strategic investment and commitment to this sector. It started off with long-term being a 5-year commitment, was extended to sort of a decade-long commitment to healthcare. And today, our board and management would be thinking of a more generational impact in healthcare. Their goal is indeed to make an impact in healthcare. It's not just the business. The second is we have a broad approach. As Amy outlined all those approaches to market, we've taken a very broad approach across multiple digital health channels and customers, using a combination of acquisitions and venture investments and organic growth into adjacent businesses. And that has put us in good stead for the highly political environment of healthcare. We followed a pretty simple 3-step strategy. We needed to become relevant and gain credibility in the healthcare market, so that kind of footprint was needed across the healthcare sector. Secondly, we are still spending a lot of time on the collaboration required in healthcare. Fragmentation is perhaps the biggest issue in healthcare, and moving data around through time and distance is what a telco does. Resolving fragmentation, which is a fundamental challenge in healthcare, is a great target for healthcare to tackle, for telcos to tackle. So step 2 of our strategy was really bringing about the collaboration in healthcare. And third step in our strategy is turning the data that moves across our network back to our customers and providing insights and analytics that frequently can't be derived unless you're pulling out collaboration, unless you can demonstrate and show what's happening between providers and how that impacts patients and populations. A fourth area where I think we've been successful and enabled our growth is we actually focused relatively early on outside the hospital, where the value proposition for transforming digital health is most relevant for a telco. Moving data between and inside the 4 walls of a hospital is not as relevant as moving data around the hospital, in the community, in the home, and between providers. And so the value proposition seemed to be stronger on those connections. And lastly, between consumers and providers in healthcare, where a telco can play, since we touch both of them. The fifth area I want to highlight is really we just have a strong brand to stand behind health. Once you gain the footprint, that brand is supportive. We have a philanthropic approach to health, and we've married the two, and that in addition to the business approach. And this makes our healthcare business not only a brand enhancer for customers, but also has been directly relevant for our employees to be involved in the healthcare space. Last, and I think perhaps most relevant, we've been patient. As a company, we've been patient to see the impact of our investment over a longer cycle that perhaps is traditional in telcos for a return on investment. Through the ups and downs of the economy, healthcare typically goes through cycles on digital health, and we persevere. So that's our healthcare background. I want to spend the next slide just giving you some understanding of really where we are today in terms of our strategy. Our health business remains very heavily focused on building collaboration and using a platform business model and a digital marketplace of our solutions to build a community, as Amy referenced, of what we call sovereign digital healthcare, an ecosystem of that, because healthcare is very local. In Canada, we suffer from the fact that we have 13 different healthcare systems, one for each province and a federal level. And so we're used to being a national carrier and having to bridge across multiple very different healthcare systems. And so building a community to address that, and then using that experience to also offer those solutions globally. So I told you before, step one of our strategy was to be relevant, and you can see the multiple channels we go to market. On the left-hand side, directly through physicians who provide a pivotal point of primary care to the system, through community pharmacies with solutions that dispense medications, and we offer solutions directly to allied health insurers, directly to consumers, institutional physicians and hospitals, as well as through employers. So, with that multitude, we really look to a platform to enable our strategy so that we can bring external service providers and patients together using a common set of technologies. We facilitate a value exchange between the individuals who need to receive care and those who are providing it. And the platform business has become a bit of a model for us to enable more plug and play infrastructure, enable us not to be constantly investing in our own digital solutions, but also to partner effectively in order to deliver top of the line global strengths back into the Canadian marketplace, right? Rather than owning the asset ourselves. So open architecture and a digital marketplace to enable that are fundamental features of our approach to market and fundamental to our collaborative approach. Today, we're using that, in fact, to help others in driving a global ecosystem of partners that could do this using common standards and technology. Again, something that telcos are quite familiar with because standards are what we live by. This opens up the avenue for partnerships, and this is kind of the background why I wanted to outline why Babylon was and is such a perfect fit for us. I'm going to move to the next slide and spend a little bit more time on that. So Babylon is the result of a global search for the right technology and a selection process. We were looking for someone who really shared our values about making an impact in healthcare and complemented our own assets. You can see that TELUS brought to the partnership a number of its own assets, a strong consumer team that was looking at addressing the health market, closely tied to our mobility team because of the like-minded approach to consumers. Much like our international team is very strongly tied to our domestic health team, so we can get the synergies from both. Babylon, and I like to use this concept because it's borrowed from retail. Much like in retail, you need an anchor tenant to draw profile and attention to your retail endeavor. Babylon is much like that because of their ability to really tackle and drive at the digital ecosystem of healthcare, drawing attention, enabling multiple adjacent businesses to flourish. Babylon provides an innovative model for addressing the most common problem in healthcare, which is the access to care, right? Many parts globally and many parts of Canada still have challenges accessing care, and the virtual nature of Babylon addresses that. And also compared to the traditional model of a one-on-one visit, Babylon provides efficiency through its screening and AI to ensure many users can concurrently get their needs met. So when we were going, where are we going with this partnership? Well, nationally, with additional scale across our multiple provincial health systems, we continue to expand across Canada, and the pandemic has certainly broken down many of the political barriers to enabling that. So that is happening rapidly as we speak, and Amy referenced that with the Teledoc commentary, and it's the same in Canada for virtual care. We'll be moving into adjacent businesses, into allied health, the direct connectivity into medication delivery, et cetera, and into specialty areas. And internationally, we work, as it's growing in importance, we work with Babylon. We see Babylon as very complementary components for companies that may be interested in a digital health business. And we've teamed up with Babylon in our approach globally to bring as I say, an anchor tenant type digital application to our platform business concept. I'm going to stop there and hand it over to Mairi, who I think will elaborate more on our partnership and on Babylon. Now I have to figure out, can you grab it?
Can you grab the baton?
How do I hand it
I think you've got it. I think you've got it now, Mairi.
Okay, so then
Excellent.
If not, I can move it if it's a bit easier. Shall I move it?
yeah, I might need you to because it doesn't need to be moving. So yeah, if you could go ahead.
Sorry, guys. There we go.
You can go forward another slide.
There we go.
Thanks. Babylon's a mission-driven healthcare company. Our whole endeavor really revolves around what David just alluded to, which is one of the biggest problems in healthcare, the problem of accessibility. So Babylon's mission is essentially to make healthcare as affordable and accessible for everyone on Earth. And we very rapidly came to the conclusion that one of the best ways to do this is to try to deliver that healthcare on the devices that most people have, because if they can get most of the healthcare most people need on the devices they already have, you can go a pretty long way in addressing the accessibility problem. This is just a sort of a high-level slide, just capturing some of the aspects of high-level numbers around Babylon, our overview of the company. We've been around since 2014. We launched our first service in the UK. Our second service is actually in Rwanda, and I'll touch a little bit on that here. We're venture-backed. We've raised, we recently closed another round last summer, $500 million. As our ratings there testify, we're all about patient experience. Everything is about really transforming the patient's experience of healthcare. And as everybody probably knows in the markets they're in, almost every market has these kinds of accessibility and patient experience problems where, for example, in the UK, it takes you 15 days to see a GP, or in places like Rwanda, for example, where there's only one physician for every 10,000 people, all of those contributing to really bad patient experience. We also have a range of technologies that we use in our services. So we use a range of things, including artificial intelligence, telemedicine tools, monitoring, disease management, etc. To deliver our services. We're getting close to 5 million users globally, and we work with tons of different clients and corporations around the world to deliver services to their employees, their members in the case of insurance companies, or their citizens in the case of when we're working with governments. We're getting close to 2 million completed appointments, and obviously this year was a really big boost on those numbers. We're live in 17 countries, and we have about 2,000 employees globally, with offices currently in Singapore, a range of places in the US, Canada, Rwanda, obviously here in the UK. This gives you just a quick overview of some of the countries where we're live and the way that we've gone to market. TELUS is our exclusive partner in Canada. In the US, we work with a range of organizations. Most recently, we launched a service, for example, with Mount Sinai Hospital System in New York. That's a direct-to-consumer service. In Africa, we work with the Bill and Melinda Gates Corporation and also, Foundation, and also the Rwandan government, we have a 10-year contract to deliver services in Rwanda with them, but it was very much enabled with the support of the Gates Foundation. In the UK, we have services that are funded mostly by private and public payers. So some of our most important services there are with the NHS, our GP at Hand service, but also significant work with big hospital systems. And then finally, we work with the government of Saudi Arabia. They use our symptom checker, and we work with Prudential across 12 countries in Asia. So those are some of our biggest partnerships globally. Just a high level, this is the core of our platform, and I think the only thing to add here is really to say that our starting point was virtual consultations, telemedicine. We added the AI capabilities because we came to the conclusion that you're not going to move the needle on affordability if you're just putting doctors behind a clinical portal to deliver services. It's not that simple, but I think it makes the point. And we started to look at what are the digital-only tools that can really move the needle on changing the economics of healthcare, as well as changing the patient experience in terms of allowing them to look after themselves. And so, while I think things like, telemedicine, which we're also focused on at the moment because of what's happened recently, is kind of an important foundation to everything in digital health, I think it's really important that healthcare companies understand that we're not talking about telemedicine, we're talking about digital health. And really to transform healthcare and invest in the space, you have to think of it in that way. You could perhaps move to the next slide. And so this slide, it won't get into the detail what it is, but basically the way, there are so many different care pathways in healthcare, from narrow and very specific and various small diseases to very big ones. And the thing that I think you should look for in any partner is one that has a range of products that can support all different types of digital health interventions, be that on the AI side, be that on, telemedicine, prescribing, referring, but also supporting people with conditions, et cetera, et cetera. And I think, organizations that the ones that we believe are going to win are going to be those that have this broader vision rather than just competing at simple telemedicine services, which will, especially with what's happened recently, become commoditized. Next. Great. So I just wanted to highlight here, I would say what we think is different about us compared to others is we think our vision and our approach with the comprehensiveness of our approach is what differentiates us. But I think the other thing that I think is important, and what I think also telcos find important, is the fact that we have a sort of a track record of delivering large scale end-to-end digital health services at scale with all the complexity and challenges that entails, with engaging complex stakeholder groups, with knowing how to integrate with national level systems, dealing with mission critical challenges, is something that I think every telco should look for in their partner in this area. These again are a smattering of services that I've already referred to, which are evidence of the way that we've done this around the globe. You go next. Great. So I wanted to spend most of the time on our service with TELUS. So what the reasons, I think David referred to the reasons what they were looking for and why they were looking for building a digital health business with Babylon. I think maybe just go back, referring to that last slide, I think that's one of the things that they saw in us. They saw the vision of a company that is not just thinking about telemedicine in a simplistic transactional way, but is thinking about what is the future of digital health. And I think our artificial intelligence solutions there appeal to them. But I think the second thing was that they just saw that we were serious. We can work with we can integrate with a national spine in the UK. We can deal with high volume services at scale in very different environments, really difficult ones like Rwanda, where we're integrating into the national ID systems, working with the government, but also the UK, which has its own challenges. So we joined together. They reached out to us originally, and we were really keen to explore with them the possibilities of doing a service together. We saw that that Canada had many of the different structures and payment systems and everything that make every country a little bit different and unique in its challenges. We felt that, and TELUS felt that what we had bringing to the table could help address the similar types of problems there, and that we could also leverage so much of what TELUS had, the stake in that market. And it was great to work with a telco that had such a deep understanding of healthcare already, understood how complex it was, wasn't going to get scared when little things blow up, which they inevitably do in healthcare, because healthcare is a political area, and so people have to have an appetite for I would say an appetite for risk and an ability to stand it when those days are tough. And I think we've seen that in spades with TELUS right from the beginning on both sides. So we launched the service together. We started we launched our service went to a hard launch in Q1 of last year, and over the last year, we grew it as quickly as we wanted to, and scaled it across the country, starting in British Columbia. But what happened was it was sort of turbocharged, obviously, this year with the COVID crisis, whereby some of the decisions we were making about rolling out in the country at a slower pace all of a sudden became a lot faster. And literally when we were, we were initially, I think at the beginning of the year, we were only live in BC, and now we're live in BC, Alberta, and Ontario. And as David highlighted, these are not, it's like dealing with different little mini health systems with different integration challenges, different payment systems, different regulations in each province, et cetera. So it's not, but we managed to get up and get running in these new provinces as the government enabled telehealth through opening up, for example, fee codes and the regulatory environment to enable that happen. So the service is a joint operation. It's co-branded, Babylon by TELUS Health, and broadly, without getting into any of the detail of that here, we share responsibilities in terms of delivery, and we share revenue and costs. TELUS's major responsibility is, not surprisingly, their distribution and sales and marketing, so we leverage all of their capabilities in that respect, their deep capabilities in that respect, as well as their infrastructure and their relationships with stakeholders, which are, again, very useful given that they're particularly active in healthcare. So they know every health minister in the country, which is always obviously important when you're doing this kind of stuff. We've rapidly grown over the year. I won't get into the detail, but I would guess we'll be 10x this year in terms of size that we were last year. And so, just to give you a sort of sense of the magnitude of growth, and that's not even launching and across all the provinces in the country. So if you want to move to the next slide. So I've touched a little bit on what I think were the key benefits that we saw and have seen or envisioned and have experienced when we joined, leveraging TELUS's infrastructure, relationships, etc. And TELUS, I think, they wanted to leverage, I think one of the things that was clear in TELUS's mind is that they couldn't be a national solution. They needed a partner. They didn't want to build a local solution on their own, because they envisaged, as you've seen everywhere, that the kind of best of breed approaches to this are going to be developed by global players. And I think the other thing that they saw was Babylon's deep clinical expertise at delivering services. So both of us have managed to bring those two things together to launch and have really good success in the first year. Not surprisingly, we've also had our challenges, and we're very transparent and open about those challenges. We talk about them all the time. We have a great working relationship with TELUS. Real testament to just, we've enjoyed it at the beginning, even in the difficult times. But not surprisingly, some of those differences revolve around different cultures, the different types of processes, the speed of movement, even just different things about, TELUS, for example, in their software business is maybe a little bit more traditional in its approach. It does like maybe 1 or 2 big releases a year. Babylon does 2 or 3 releases a day. In terms of, it's a different style of working. And so getting to grips with those kinds of things was obviously important. and the different speeds that each party are going through. The other thing, I think one of the other challenges we had to figure out was what kind of brand can we have in the Canadian market that reflects both of us. So there was a lot of, I think, we had a lot of challenges about trying to work together something that both leverage TELUS's brand, because that was important to obviously to leverage one of the major benefits of working with TELUS in Canada, but also somehow reflected something about Babylon. And so, and to be honest, I think that what we probably have there will probably evolve. That's certainly under discussion. We maybe we'll change it, and which is again a good aspect of the relationship. We're all very open to really what works in the market, rather than getting stuck on our own names or brand identities. Stakeholder management is also a challenge, and I think it's probably quite obvious that would be the case. TELUS has deep relationships with stakeholders in Canada that they value and that is important to their entire business. Babylon has to have relationships with stakeholders as a clinical service provider, so we have to have direct relationships with them, because again, healthcare is complex, and you have to be able, and is highly regulated as well, so you have to have an open conversation with the government. TELUS has different interests in those conversations with the government than we do sometimes, and it's an inevitable part of, and that's reflective of, what TELUS is trying to do as a whole in the country, as opposed to what's important just to Babylon. So we are constantly trying to figure out ways to manage those kinds of tensions. And then I think, there's just general, we need to work with work through general partnership working, given, and I think that comes to the fore, maybe particularly for telcos who maybe haven't partnered so much and are used to having control. And in a relationship like ours, where we're delivering, a major part of the delivery, we're delivering services, obviously, you can't have control. It has to be collaborative. It has to be a good decision. And so inevitably, we've had to work hard to work through those things, and we're evolving them all the time. So that's some of the highlights, and I think I'll just leave it there and let people jump in for questions.
Great. Thanks a lot, Amy, David, and Mairi for those presentations. And just a quick reminder again, if you do have any questions for the panel, you should have a tab in your GoToWebinar platform, which will allow you to ask some of those questions, and we'll hopefully have time to get through to them. So the first one, and I think, Amy, you touched a little bit on this in your presentation, and also yourself, Mairi. So I think I'll go to you, Amy, first, and then to you, Mairi. But if telcos have such a right to play in this space, and it's something that STL have said quite often, why is it that only a few carriers are betting on this with long-term commitment, and why only a few carriers are actually being successful? And do you expect this to change kind of in 1 or 2 years' time in a post-COVID era? So that question there from Fernando, and Amy, if you go first.
Yeah, so from my perspective, can you guys all hear me?
Yeah.
So from my perspective, I think it's just that it's daunting. There's a lot of liability, right? If you go in and you're serving the healthcare sector, if something goes wrong and you're the one responsible for it, then that's potentially a very difficult position to be in as a telco, and not everyone is necessarily willing to take that risk. I think the other element, though, which is far more important, and comes back to David talking about TELUS first making a 5-year commitment, then a 10-year commitment, then a generational commitment. The reality is that things move so slowly but most telcos are thinking, on a quarter-by-quarter basis. When they do innovation or launch a new service or what have you, they're looking for return immediately, within a few quarters, within a year. And the reality is that healthcare just doesn't move that quickly. And it takes a lot longer to build that business and build that credibility and get people to change working habits. And, all this discussion we've been seeing about, like Mairi is saying, they're getting a 10x growth probably, or expecting a 10x growth this year because of the crisis situation. Without that, we would have seen very slow bit by bit growth. And the reality is we might have a great year this year, but it doesn't change that it's going to be still a long-term play to change the healthcare system, and most telcos just don't have the patience.
Maybe I can pick up just where you dropped off, Amy, and I would argue that's precisely why telcos should be in healthcare. It's nothing fly by night. It's not easy. And that's why you can differentiate around it, right? I mean, some of the telcos that reached out to us early on in our development, I remember one of them came to me with a proposal that we would do a partnership with them, something like Spotify, and doing that kind of partnership, you know, which is just about some easy consumer offer that requires no real investment in infrastructure, et cetera. You know, it's a different kind of investment, a different kind of decision making. So I think that's one of the reasons that people be scared to take this step into something that seems complex and difficult. But I think that's precisely the reason we should do it. I mean, so I don't believe the current number of telcos active in healthcare is a reflection of what we will see going forward, and we see it just ourselves. The amount of interest from telcos. We have conversations with at least one telco in every continent at the moment, who are having a substantive conversation with us about possibilities.
Maybe I could just add, I think it's relevant that TELUS actually does not publish the financial numbers of its healthcare business, and we bury it or include it as part of our wireline business, along with a number of other relatively innovative business propositions. And despite multiple requests from analysts and others to reveal, you know, what's the growth, what's the size and magnitude of our health business, we've resisted that in order to allow us to continue to foster the growth over the time frame, right? So despite the multiple requests, we show excellent wireline results every year, and in that it's partially due to healthcare, but we're not exposing our healthcare numbers to expectations of our investors. We're protecting it so that we can make a longer term investment in healthcare.
Yeah, that's really interesting. And actually, there's a question here from Tuba, which is kind of on this point and asking for a few of those numbers, which obviously you aren't at liberty to reveal. But maybe the second part of this question, which was looking at, well, how do you, if you're kind of not looking at it as a segregated part of the business, and it is, you know, all about how it ties in with your wireline revenues, how do you value the digital health kind of arm that you have, and how do you kind of justify some of that long-term investment? Because, you know, he's mentioned it's been 10 years and billions that have been invested. So is it really down to that core proposition of just wanting to improve health outcomes, or, you know, how are you valuing the health business if it's not looked at a segregated level?
I can assure you that TELUS inside looks at it as a segregated level in order to ensure that it's growing at, I would estimate, about 4 times the traditional growth rate of us as a telco. So it's clearly contributing to our overall wireline numbers, which, you know, if analysts look at those, they're very happy with those when they compare them to other telcos. So it's a contributor. So, you know, the reality is we've been able to balance the fact that if someone looks at our wireline and how we protected that business by putting innovative new businesses in there, you know, we're clearly mitigating the challenge it is to retain a wireline revenue stream. And that's kept analysts happy. And so internally, we run it as a separate division. We clearly pay a lot of attention to how it's growing, but it does give us some affordable protection from the specifics that would come if we exposed it and published it as a separate line item.
Okay, brilliant. And we have a couple of questions here from Igor in terms of business model. And Amy, maybe if I put the first half to you, and then David, if you could answer the second half. But you know, there are a couple of different business models that you spoke about, Amy, from B2B through to B2B2C through to B2C. You know, could you discuss maybe a little bit around some of the pros and cons of each and why a telco might, you know, choose to go one route or another? And then David, there was the question for you on, you know, what drove TELUS to go from providing IT and business processes and business process outsourcing from B2B to offering kind of B2C teleconsultations with Babylon. So what was that process? So if you could go through that.
I'll just go super quickly and give you, you know, the high level answer to that is that we've seen telcos have more success with a direct B2C approach in markets where the access to healthcare problems are much bigger. So if you look at emerging markets, you know, a great example we like to talk about is Tonic in Bangladesh, where they offer sort of a freemium health insurance offer directly to consumers, and they go to market in partnership with NGOs and pharmacies. And that B2C approach works because, like the Rwanda case, the access to healthcare is so much lower. The proportion of doctors available is so much lower that that B2C approach is a little bit more credible. But by contrast, if you look at European markets or Canada or the US, people are not necessarily paying out of pocket. It has to go through an insurance provider, or it has to go through the national payer. And so a lot of the time, the B2C market there is a lot more difficult. And there may be pockets where people are willing to pay, for instance, with parents who are elderly and want to live at home. But the vast majority of stuff needs to be paid for by the insurance or the public funder.
So I'll pick up on that, and given time, I'll be short because this is a long thesis type question and answer. We've been struggling with the B2C concept since 2008. In Canada, we have a very large universal healthcare system, and the average consumer mentality is they shouldn't have to pay for healthcare. And so very, very difficult to get consumers to pay directly. So we offer a service direct to consumers, but in fact, the payer of a Babylon, the payer of virtual care is actually the provincial government, right? It's a covered service. And so we've tried in the past to have individuals pay, and despite general perceptions that there'd be a great demand for that, in reality, it's not a big business in Canada to have a direct payment from a consumer. Where it's really taken off is when you can get that service covered under a payment from an employer, payment from a hospital, payment from a government. So those are three avenues that we found more successful, right? The executive health coverage and payment for your employees, the coverage of a provincial government to provide virtual care services instead of an in-person visit, and the payment for insurance to provide services directly to their beneficiaries because it's cheaper, faster, more convenient. So our B2C has been much more along the wellness side than on the healthcare provision side. And I'll stop there because I could go on for a long time.
Okay, great. And a question for you, Mairi, maybe, is a little bit about, obviously there's an immediate need that has happened due to COVID and the pandemic. And this has obviously accelerated growth, as Amy showed, in things around telehealth and virtual consultations. And I guess the question is, what should telcos be considering from a longer term standpoint around some of these applications? Because they need to serve an immediate need, or they could be serving an immediate need, but what do they need to consider for the long term or the longevity of these applications, and make sure they don't kind of rush to an end goal, if that makes sense?
Well, I think that I would go back to what I said earlier, which is that telemedicine is a starting point, but it shouldn't be your end point. Telemedicine is essentially a sort of a transactional type of healthcare that is suitable for only a certain percentage of the healthcare pie in terms of healthcare problems. As soon as you start to get even more complex parts of primary care, by primary care I mean a model whereby you have a sort of that set of simple needs that people tend to present to a GP before they get referred on to more complex specialist care. Even when you start to get into more complex parts of primary care, you start to really need to start to have a more holistic approach, thinking about a whole range of needs like mental health, condition management, all of these types of issues. So it's not about going and saying I have an infection and just getting a prescription or something like that. It's really about having a long-term relationship with patients and being their overall healthcare provider. The other thing is, I think that like any new digitization or digital entry into a very traditional and old school part of the economy, the impact is discovered as you go along. And so you don't go in and you don't think, I'm going to take over part of this part of the healthcare system and just digitize it, because as soon as you start doing it, you realize that what the real power of what your technologies and products and stuff like that can be actually transformative in many ways, transformative of the economics, completely transformative of business models, et cetera, et cetera. And we haven't had a chance to talk about these. Maybe that's a follow up to talk about some of those insights. But just to give you a simple example, one of the challenges of healthcare is that it's siloed. You have primary care, there's budgets oriented towards primary care. You have secondary care, which tends to be done in hospitals, and there's budgets is oriented towards that. But the very silos are part of what mitigates against creation of value in a system in terms of solving problems. For example, one of our main discoveries through our primary care services is that if you throw lots of resource at primary care, you dramatically decrease downstream costs in secondary care. This is a huge interest to stakeholders, government payers, etc. And there's, we have some evidence of that already in our services, but we're going to be sharing more soon. Like really transformative, massive differences in savings. And you can really only do that kind of thing in digital models. And so I guess what I would encourage people to do is to sort of dip your toe in, start with foundation, look at areas like telemedicine. Telemedicine is going to be big. Everybody's going to do it. And governments all over the world are opening it up regulatorily and with payment systems. And consumers are obviously adopting much more. But think about it, be ready that this is probably, you're going to be building, if you want to really play in the space and build a massive business, you're going to be adding new capabilities every year, addressing more and more parts of the market. And that is what's exciting. Maybe goes to, I would say what is my final point around why telcos should play in this space is the part of the reason telcos aren't in the space before is because it was a tiny space. It was really hard to get digital adoption in healthcare. All of a sudden it's happening. And I think telcos have the opportunity to get into this opportunity right at ground zero, year one of what will probably be a 30-year cycle of change and transformation. So yeah, I'll leave it at that.
Great. And I'm just conscious of time, but I do want to ask one more question because I think it's quite a good one. If we didn't have time to get to your question, we will be hopefully able to do it in the follow-up, which we'll send around. So if you do have a burning question, do still put it in the chat. But we have one here from Perry, who's mentioned that he is Canadian. So I'll put the question to the two Canadians on the call. But first going to you, David, does TELUS envision eventually spinning out the health division, or is it intent on building it as kind of a core TELUS brand in healthcare? Will it eventually become that actually you can see TELUS as your health provider as opposed to the telco? And I want to put kind of that to you as well, Amy, because I know you have some experience or knowledge around kind of Tonic and what they've been doing in Bangladesh and kind of working beyond the realms of the telco. So two parts to that question again, and then we'll finish.
Good question. And Darius, you probably need to know that Amy and Mairi are also Canadians. There's 3 Canadians on this call, so a bit challenging to direct it to me. However, let me start with a more provocative answer. Darren Entwistle, our CEO, has actually formally made statements that he could envision a time in future when TELUS is in fact a digital health company and not a telecommunications company. So, that's a provocative statement by him, but made in public. I think while there's always been discussions around whether to spin it out or not, it's not on the table today. It is and has become a core identity and differentiator of TELUS. And as such, not on the table seriously for that kind of a spin out. We are very aware that a digital health business is valued quite differently than a telecommunications company in today's world. And so, getting it to a size and magnitude where that would be entertaining is certainly a good challenge for us. But I've yet to hear any serious debate of a spin out. In fact, I've heard the reverse, that it is a pervasive part of who we are. So Amy, you can attempt to answer that.
Well, I won't attempt to answer it based on TELUS. Obviously, we've got it from you, so that's a great answer. I think I would just say that, what we've looked at more broadly, not just in healthcare, but when telcos try to innovate new businesses, is that a lot of the time they get stifled when they're just in part of the core business. And if if it's too close to the core business, then how you're trying to value it, how you're trying to justify it as a business is that it grows your connectivity revenues. And that may not always work. And so by keeping it separately, then you're more focused on what is the outcome that we are delivering, what is the actual solution or problem that we are solving for the end customer, not just trying to convince your connectivity customers to buy a little bit more from you. And that changes the mindset and the approach, whether that's in healthcare or any other field. And so that's an argument for doing that. And as obviously for TELUS, it's worked well going the other way. But I think it's a decision that each telco can make based on their past experience and how well innovating from the core has worked for them in the past.
You need to be, just to top up, Amy, you need to be mindful that when you're delivering healthcare, you can't just deliver it to those who have your own telco services. Yeah. You're delivering it to a population.
Perfect. Good point to finish on. So apologies if we didn't get round to your questions, but hopefully we'll be able to do that in the follow-up. Well, thanks a lot for joining. We'll be sending the recording and the slides to those who've registered shortly. And yeah, well, thanks a lot for joining. And when you exit the webinar, you should receive a survey, which you can fill out to let us know any feedback, again, any questions that you have, and let us know if there is anything that you'd like to see us cover in the future. So thanks a lot. Hopefully speak to you guys soon.
And thank you very much, David and Mairi, for joining us. Bye, everybody.
Bye, everyone.
Thank you.